Hello. Today we'll be discussing one of the most important topics in pharmaceutical and clinical sciences, diabetes mellitus, commonly referred to as sugar disease. It's not just a major public health issue in India, but a global concern. In fact, India has one of the highest numbers of diabetic patients in the world. In this lecture, we aim to cover a wide range of aspects related to diabetes mellitus. Let's break down the objectives for today's session. Definition: what exactly is diabetes? What does mellitus mean? We'll see how it's not just about high sugar, but involves insulin regulation and multi-organ effects. Classification: you'll learn about the major types: type 1, type 2, gestational, and some lesser-known variants like MODY and LADA. Etiology and risk factors: we will understand what leads to diabetes, genetics, obesity, lifestyle, and even medications in some cases. Pathophysiology: we will examine what happens in the body when diabetes develops, including insulin resistance and beta cell destruction. Clinical features: how do we recognize diabetes? What symptoms should a pharmacist look out for in patients who may not know they're diabetic? Diagnosis: what are the diagnostic criteria as per ADA and WHO? We'll decode the importance of FBS, OGTT, HbA1c, and more. Complications: we'll look at short-term emergencies like diabetic ketoacidosis and long-term complications like retinopathy and nephropathy. Treatment and management: this is the core for you as pharmacy students. We'll look at both pharmacological, like insulin and oral agents, and non-pharmacological treatments, diet, exercise. Let's begin our journey into understanding diabetes in a scientific yet practical manner. Now that we've seen what we will be covering, let's start with the basics. What is diabetes mellitus? The term diabetes comes from the Greek word diabenein, meaning to pass through, referring to the frequent urination seen in uncontrolled diabetes. Mellitus, from Latin, means honey sweet, which refers to the sweet smell or taste of the urine, as early physicians noted. Before modern diagnostics, the presence of sugar in urine was detected by taste. Thankfully, we now use glucose strips. According to the World Health Organization, diabetes mellitus is a metabolic disorder of multiple etiologies, characterized by chronic hyperglycemia, which means persistently high blood sugar, and disturbances in carbohydrate, fat, and protein metabolism. Why does this happen? Either the pancreas is not producing enough insulin, as in type 1, or the body cells are resistant to insulin's action, as in type 2, or sometimes a mix of both. It's important to understand that diabetes is not just a sugar problem. It's a complex endocrine condition that affects almost every organ system over time, including eyes, kidneys, nerves, and heart. Also note, diabetes is a chronic disease. It doesn't go away. But with proper management, patients can live full, healthy lives. Your role as pharmacists will involve educating patients who often think, "I'll just stop sweets and I'll be fine." No, it's more than that. Management involves monitoring, medication adherence, lifestyle changes, and long-term risk reduction. So now that we understand what diabetes is, let's move on to the classification. Diabetes mellitus is not a one-size-fits-all condition. There are multiple types, and each has its own mechanism, clinical profile, and treatment approach. There are 4 primary categories we focus on in clinical and academic settings. Type 1 diabetes mellitus, T1DM, often called insulin-dependent diabetes or juvenile-onset diabetes. It's an autoimmune condition. Your body's immune system attacks the insulin-producing beta cells in the pancreas. Without insulin, glucose cannot enter cells, leading to hyperglycemia. Typically begins in childhood or adolescence, but can occur at any age. These patients require lifelong insulin therapy. Type 2 diabetes mellitus, T2DM. This is the most common form, over 90% of all diabetic cases. It's largely lifestyle-associated, often linked with obesity, inactivity, and diet. In T2DM, insulin is produced but the body's cells become resistant to it, or secretion is insufficient. Most patients are diagnosed in adulthood, but worryingly, more young people are now affected due to lifestyle changes. Gestational diabetes mellitus, GDM, occurs during pregnancy. Hormonal changes and insulin resistance, lead to elevated blood sugar. It often resolves after delivery, but both mother and baby are at increased risk of developing T2DM later in life. Screening during pregnancy is crucial. Other specific types. These include maturity-onset diabetes of the young, a rare genetic form, usually inherited. Latent autoimmune diabetes in adults has features of both type 1 and type 2. Secondary diabetes due to drugs, e.g., steroids, pancreatic diseases, endocrine disorders. Each of these types has different causes, progression, and management protocols. As pharmacists, your role is to recognize the type based on medication profile and symptoms, which is essential in providing accurate advice and support. Let's now look a little deeper into type 1 diabetes mellitus, which has a unique pathophysiology and clinical profile. Type 1 DM is primarily an autoimmune condition. The immune system mistakenly targets the insulin-producing beta cells of the pancreas, gradually destroying them. This leads to complete insulin deficiency, which is why insulin must be administered externally. It's commonly diagnosed in children and young adults, but onset can happen at any age. The destruction is usually rapid, so the presentation is acute. Patients often come in with the classic triad: polyuria, excessive urination; polydipsia, excessive thirst; polyphagia, excessive hunger. Despite increased eating, patients lose weight due to the catabolic state. If untreated, patients can develop diabetic ketoacidosis, DKA, a life-threatening emergency where the body breaks down fat, leading to a buildup of acids called ketones. Here's a crucial point. Because these patients have no endogenous insulin, oral hypoglycemic agents do not work. Insulin therapy is essential for survival. Typically, a basal bolus regimen is started and lifelong blood glucose monitoring is necessary. As pharmacists, you will need to educate patients and caregivers on insulin administration, storage, recognizing signs of hypoglycemia, and dietary adjustments. Early detection and supportive counseling can significantly improve outcomes and reduce complications. Now, let's turn our attention to type 2 diabetes mellitus. This is the type you'll encounter most frequently in your practice. Type 2 DM is a chronic, progressive metabolic disorder that results from a combination of two main defects: insulin resistance. Body's cells do not respond properly to insulin. Relative insulin deficiency. Pancreas cannot keep up with the body's demand. Initially, the pancreas compensates by producing more insulin, but over time, this capacity declines, leading to chronic hyperglycemia. Unlike type 1, patients are often asymptomatic in early stages. It may be discovered incidentally during routine checkups. Symptoms, when they appear, include fatigue, blurred vision, slow wound healing, frequent infections, and of course the polyuria, polydipsia, polyphagia triad. T2DM is strongly linked to lifestyle, obesity, high-fat diet, sedentary behavior, stress, and genetic predisposition are major contributors. This type of diabetes is usually managed initially with lifestyle modification, diet, exercise, weight loss. If that's not enough, oral antidiabetic drugs, OADs, like metformin, sulfonylureas, or DPP, for inhibitors are added. Insulin may be needed if control is poor. As a pharmacist, your role in monitoring adherence, detecting drug interactions, and motivating lifestyle changes is extremely important. Let's now talk about a special form of diabetes that occurs during pregnancy: gestational diabetes. GDM is defined as glucose intolerance that is first detected during pregnancy, typically between 24 to 28 weeks gestation. It occurs because of hormonal changes, such as increased levels of human placental lactogen, that induce insulin resistance. Why is GDM important? It increases risk of complications during delivery, including macrosomia, large baby, preterm birth, and cesarean section. The mother is at increased risk of developing type 2 diabetes later in life. The baby is at risk of neonatal hypoglycemia, obesity, and glucose intolerance in childhood. Screening is done using oral glucose tolerance tests, OGTT. In India, the DIPSI, Diabetes in Pregnancy Study Group India, method is commonly used. Management includes medical nutrition therapy, MNT, physical activity, If uncontrolled, insulin therapy is preferred over oral antidiabetic drugs for safety reasons. Your role here is to counsel expecting mothers, reinforce adherence, and follow up post-delivery to reduce future risks. So, what exactly causes diabetes? To understand that, we need to look at both the root causes and the risk factors that contribute to its development. The causes differ a bit between type 1 and type 2 diabetes, though there is some overlap. Let's start with type 1 diabetes. This type mainly happens because the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Genetics play a role here. Certain genes like HLA, DR3 and DR4 increase susceptibility. Sometimes, viral infections such as Coxsackie virus might trigger this autoimmune response. There might be environmental factors too, but scientists are still researching those. Now, moving to type 2 diabetes, which is far more common. Genetics again is important. If someone in the family has diabetes, the risk increases. But lifestyle factors have a huge impact here. Obesity, especially excess fat around the abdomen, is a major culprit. A sedentary lifestyle and unhealthy diets, especially those high in sugar and processed foods but low in fiber, also contribute heavily. Although type 2 diabetes typically affects people over 40, we're seeing it more in younger individuals these days. Other risk factors include hypertension and abnormal cholesterol levels, which are part of what we call metabolic syndrome. Certain ethnicities, like Indians, are genetically more prone to developing type 2 diabetes. Besides these, other medical conditions such as endocrine disorders like Cushing's syndrome or pancreatic diseases like pancreatitis can also cause diabetes. Plus, some medications, including corticosteroids, thiazide diuretics, and certain antipsychotics, can induce diabetes as a side effect. By understanding these causes and risk factors, we can better identify individuals at risk, offer preventive advice, and catch diabetes early through screening. This knowledge is especially important for you as pharmacists because you'll often be the first point of contact for patients. Let's dive into the pathophysiology of type 1 diabetes, which is primarily an autoimmune disease. In T1DM, the body's immune system mistakenly targets and destroys the beta cells of the pancreatic islets of Langerhans. These beta cells are responsible for producing insulin, the hormone crucial for glucose uptake by tissues. This destruction occurs over months to years, eventually leading to absolute insulin deficiency. Without insulin, glucose cannot enter cells, especially muscle and fat cells, and remains in the bloodstream, causing hyperglycemia. Since cells can't use glucose for energy, the body starts to break down fat stores for fuel, leading to the production of ketone bodies, acetoacetate, beta-hydroxybutyrate. Accumulation of these ketones causes metabolic acidosis, resulting in diabetic ketoacidosis, DKA, a medical emergency characterized by dehydration, electrolyte imbalance, and altered consciousness. This explains the classic symptoms of T1DM and the urgent need for insulin replacement. In contrast, the pathophysiology of type 2 diabetes is more complex and involves both insulin resistance and progressive insulin secretory defect. In T2DM, the body's tissues, muscle, fat, liver, become resistant to insulin. This means despite insulin presence, glucose uptake is reduced. The pancreas initially compensates by producing more insulin, resulting in hyperinsulinemia. Over time, beta cell function deteriorates due to chronic overstimulation and other factors like glucotoxicity and lipotoxicity. The liver contributes by increasing hepatic glucose production, further raising blood sugar. This leads to chronic hyperglycemia with a slow, progressive onset. Other metabolic abnormalities include increased breakdown of fats-free fatty acids exacerbate insulin resistance, altered secretion of incretins, gut hormones, that regulate insulin. Understanding this complexity helps tailor treatment options that can improve insulin sensitivity or stimulate insulin secretion. When we talk about diabetes, the classic symptoms often give us the first clues. These symptoms mainly come from high blood sugar, affecting various parts of the body. One of the most common signs is polyuria. This means frequent urination. Because the blood sugar is very high, excess glucose spills into the urine, pulling water along with it, so patients urinate more often. This leads to polydipsia, or excessive thirst, since the body loses so much water through urine that it becomes dehydrated and triggers the sensation of thirst. Another key symptom is polyphagia, which means increased hunger. Even though there's plenty of sugar in the blood, the cells can't use it properly for energy, so the body feels starved and prompts the person to eat more. In type 1 diabetes especially, you'll often see weight loss because the body starts breaking down muscle and fat for energy when it can't access glucose. Patients may also feel fatigue and weakness due to inefficient glucose use. Some people experience blurred vision. This happens because high blood sugar causes fluid shifts in the lens of the eye, affecting focus. You might also notice slow wound healing and frequent infections, since elevated glucose weakens the immune system's ability to fight germs. A more subtle symptom is numbness or tingling in the hands and feet, which is an early sign of nerve damage or diabetic neuropathy. It's important to remember that in type 2 diabetes, these symptoms can be mild or even absent at first. Many patients get diagnosed only during routine checkups or after complications appear. As future pharmacists, your role is vital. You need to recognize these symptoms early, encourage patients to get tested promptly, and provide education that can prevent or delay serious complications. Now, let's talk about how diabetes is diagnosed. This is a key part of your role because understanding lab tests helps you guide patients properly. The main tests used are blood glucose measurements and HbA1c, which shows average blood sugar over the past 2 to 3 months. First, we have the fasting plasma glucose test. The patient fasts for at least 8 hours, and if their blood sugar is 126 milligrams per deciliter or higher on 2 occasions, diabetes is confirmed. If it's between 100 and 125, that's called prediabetes, meaning the person is at risk but not yet diabetic. Next is the oral glucose tolerance test, or OGTT. After fasting, the patient drinks a 75-gram glucose solution, and blood sugar is checked 2 hours later. A level of 200 milligrams per deciliter or more indicates diabetes. Between 140 and 199 shows impaired glucose tolerance, another form of prediabetes. The random plasma glucose test can also be diagnostic if it's over 200 milligrams per deciliter and the patient has symptoms like increased thirst and urination. Then, there's the HbA1c test, which reflects long-term blood sugar control. An HbA1c of 6.5% or higher confirms diabetes, while 5.7 to 6.4% suggests prediabetes. Usually, doctors repeat tests to confirm diabetes unless symptoms and blood sugar are clearly high. Knowing these tests helps you interpret reports and educate patients about their condition. You can encourage those at risk to get tested early to prevent complications. So, understanding these criteria is vital in your role as a pharmacist for supporting diabetes care. Diabetes doesn't just stop at high blood sugar, it affects almost every organ system if left uncontrolled. So, understanding its complications is crucial, especially for pharmacists who often see patients regularly. First, there are acute complications. These are emergencies that can develop quickly. Diabetic ketoacidosis, DKA, mainly occurs in type 1 diabetes. When there's no insulin, the body burns fat for energy, producing ketones which make the blood acidic. Patients become very sick with vomiting, dehydration, rapid breathing, and may lose consciousness if not treated urgently. Hyperosmolar hyperglycemic state, HHS, happens mostly in type 2 diabetes, usually in older adults. Blood sugar spikes very high, causing extreme dehydration but without ketoacidosis. It requires emergency treatment too. Then, we have chronic complications. These develop over years due to persistent high sugar damaging blood vessels and nerves. Microvascular complications affect small vessels. Retinopathy, damage to eye blood vessels, leading to vision loss. Nephropathy, kidney damage causing protein in urine and eventually kidney failure. Neuropathy, nerve damage causing numbness, pain, especially in feet, increasing risk of ulcers and infections. Macrovascular complications involve larger vessels. Increased risk of heart attacks, strokes, and peripheral artery disease. Good blood sugar control, blood pressure, and cholesterol management can prevent or slow these complications. Pharmacists play a key role in counseling patients on medication adherence, lifestyle changes, and recognizing warning signs early. Understanding complications helps you motivate patients to take diabetes seriously and maintain regular follow-ups. Now that we understand what diabetes is and its complications, let's focus on what we aim to achieve with treatment. Treatment goals guide every decision in managing diabetes. The primary goal is to maintain blood glucose levels as close to normal as possible to prevent both acute and chronic complications. We want to keep fasting blood sugar generally between 80 to 130 milligrams per deciliter and post-meal glucose below 180 milligrams per deciliter. The HbA1c target is usually below 7%, but this can be individualized based on the patient's age, health status, and risk of hypoglycemia. Besides blood sugar, controlling blood pressure and lipid levels is equally important because many patients with diabetes also have hypertension and high cholesterol, which increase the risk of heart disease and stroke. Another important goal is to prevent or delay complications by encouraging healthy lifestyle habits like balanced diet, regular exercise, quitting smoking, and weight management. We also want to educate patients on recognizing symptoms of hypoglycemia and hyperglycemia, as well as ensuring medication adherence. As pharmacists, your role is critical in reinforcing these goals during every patient interaction. You help monitor progress, support lifestyle changes, and ensure patients understand why maintaining these targets matters for their long-term health. Managing diabetes is a multi-step, lifelong process that combines lifestyle changes, medication, and regular monitoring. The goal is to keep blood sugar in check and prevent complications. The first and most important step is lifestyle modification. This includes a healthy, balanced diet, low in simple sugars and refined carbs, and regular physical activity. Exercise helps improve insulin sensitivity, making your body use glucose more efficiently. Weight management is especially crucial in type 2 diabetes. If lifestyle changes aren't enough, we add pharmacotherapy. For type 1 diabetes, insulin replacement is mandatory because the pancreas cannot produce insulin. There are different types of insulin, short-acting, intermediate, and long-acting, to mimic the body's natural insulin pattern. In type 2 diabetes, we have many oral medications and some injectable drugs. These include drugs that increase insulin secretion, like sulfonylureas, improve insulin sensitivity, like metformin, delay carbohydrate absorption, or affect kidney glucose excretion, SGLT2 inhibitors. The choice depends on the patient's condition, blood sugar levels, and other health factors. Regular monitoring of blood glucose at home and periodic HbA1c testing are essential to track how well treatment is working. Additionally, managing blood pressure, cholesterol, and screening for complications is part of comprehensive care. As pharmacists, you have a vital role, counseling patients on how to use medicines properly, recognize side effects, encourage adherence, and motivate healthy lifestyle changes. You act as a bridge between the doctor and patient, ensuring diabetes management is effective and sustainable. Before we rely on medicines, it's important to understand that non-pharmacological management forms the foundation of diabetes care. Lifestyle changes are powerful tools that can prevent, delay, and sometimes even reverse the progression of type 2 diabetes. First, let's talk about diet. Patients need to focus on a balanced diet rich in complex carbohydrates like whole grains, fiber, fruits, and vegetables, which help control blood sugar levels. Avoiding simple sugars, sugary drinks, and excessive saturated fats is crucial. Portion control is also important to maintain a healthy weight. Next, physical activity plays a vital role. Regular exercise, like brisk walking, cycling, or swimming, improves insulin sensitivity, helps lower blood glucose, and aids in weight loss. Even moderate activity for 30 minutes a day, most days of the week, can make a big difference. Weight management is another key aspect. Losing even 5 to 10% of body weight can improve insulin resistance and blood sugar control. Patients should also avoid smoking because it increases the risk of cardiovascular disease, which is already higher in diabetes. Stress management and adequate sleep are often overlooked but affect blood sugar levels too. As pharmacists, you can educate patients on these lifestyle changes, motivate them to stick to their plans, and support them in overcoming challenges. Remember, medicines are important, but lifestyle remains the cornerstone of diabetes management. Let's now talk about one of the most important treatments for diabetes: insulin therapy. Insulin is essential for type 1 diabetes because the body's pancreas can no longer produce it. It's also used in many type 2 diabetes cases when other treatments aren't enough to control blood sugar. Insulin works by allowing glucose to enter cells, providing energy and lowering blood glucose levels. There are several types of insulin based on how quickly they start working and how long they last. Rapid-acting insulin starts working within 15 minutes and lasts a few hours. It's often used around mealtimes. Short-acting insulin takes about 30 minutes to start and lasts 5 to 8 hours. Intermediate-acting insulin begins working in 1 to 2 hours and lasts 12 to 18 hours. Long-acting insulin provides a steady insulin level over 24 hours or more. Sometimes, a combination of different insulin types is used to mimic the body's natural insulin pattern. Insulin is usually given by injection, subcutaneously. Newer delivery methods like insulin pens and pumps improve convenience and control. As pharmacists, you need to educate patients on proper injection techniques, storage of insulin, recognizing and managing hypoglycemia, and the importance of adherence. You also counsel about lifestyle factors that affect insulin needs, such as diet and exercise. Understanding insulin types and their actions helps you support patients in optimizing their diabetes control safely and effectively. Now that we've covered the types of insulin, let's explore how insulin therapy is organized into different regimens. Choosing the right regimen is crucial because it helps mimic the body's natural insulin secretion and achieves good blood sugar control. There are several common insulin regimens, and doctors select one based on the patient's lifestyle, blood sugar patterns, and treatment goals. One simple approach is the once-daily regimen, usually using long-acting insulin at bedtime to provide a baseline insulin level. This is often started in type 2 diabetes patients when oral drugs are not enough. The twice-daily regimen involves mixing intermediate-acting and short-acting insulin before breakfast and dinner. This covers basal insulin needs and mealtime spikes. For tighter control, especially in type 1 diabetes, the basal bolus regimen is popular. It uses long-acting insulin once or twice daily for basal coverage, plus rapid-acting insulin before each meal to control post-meal glucose rises. This regimen closely mimics natural insulin secretion. There's also the continuous subcutaneous insulin infusion, CSI, or insulin pump therapy, which delivers rapid-acting insulin continuously through a small device. It offers flexibility and precise control but requires careful monitoring. Each regimen has pros and cons. More injections usually mean better control, but can be less convenient. As pharmacists, understanding these regimens helps you explain treatment plans clearly, support patients in managing injections, and recognize when adjustments or referrals might be needed. Proper insulin use is key to preventing complications and improving quality of life for diabetic patients. Moving on from insulin, let's discuss oral antidiabetic drugs, which are the mainstay treatment for type 2 diabetes. These medications help control blood sugar through different mechanisms, and understanding these helps you counsel patients better. The first and most commonly used drug is metformin. It works by reducing glucose production in the liver and improving insulin sensitivity in muscles. It's often the first drug prescribed because it's effective, safe, and even helps with weight control. Next, we have sulfonylureas like glibenclamide and glipizide. They stimulate the pancreas to release more insulin. However, they can sometimes cause low blood sugar, hypoglycemia, so patients must be careful. Another class is thiazolidinediones. These improve insulin sensitivity but have some side effects like fluid retention, so their use is cautious. There are also drugs like DPP for inhibitors and GLP-1 receptor agonists that enhance the body's natural hormones to increase insulin release and reduce appetite. Lastly, SGLT2 inhibitors help the kidneys remove excess glucose through urine, which also helps with weight loss and blood pressure. As pharmacists, you'll help patients understand how to take these medicines, watch for side effects, and encourage adherence for better outcomes. Monitoring blood glucose regularly is a cornerstone of effective diabetes management. It helps both patients and healthcare providers understand how well the treatment is working and make necessary adjustments. There are two main types of monitoring: self-monitoring of blood glucose, SMBG, and laboratory testing. SMBG involves using a glucometer at home to check blood sugar at various times, before meals, after meals, or at bedtime. This gives immediate feedback and helps patients manage their diet, exercise, and medication. It's especially important for those on insulin or prone to hypoglycemia. Laboratory tests include fasting blood glucose and HbA1c. HbA1c gives an average of blood sugar control over 2 to 3 months and is a key test during clinic visits. Educate patients on how to properly use glucometers, maintain logbooks, and recognize patterns. This empowers them to take control of their condition. Your role includes reinforcing the importance of monitoring, helping troubleshoot issues with devices, and advising when to seek medical help based on readings. Effective monitoring is not just numbers. It's about improving patients' quality of life and preventing complications. Now, let's take a look at diabetes in the Indian context. India has one of the highest numbers of people living with diabetes in the world, earning it the unfortunate title of the diabetes capital of the world. There are several reasons for this. Genetics play a role. Indians tend to have higher insulin resistance and a tendency to develop diabetes at a younger age and at lower body weights compared to Western populations. Lifestyle factors, such as urbanization, sedentary habits, unhealthy diet rich in carbohydrates and fats, and increasing obesity rates also contribute. Another challenge is the lack of awareness and limited access to healthcare in many regions. Many people are diagnosed late or not at all, leading to serious complications. As future pharmacists, you have a crucial role in raising awareness about diabetes prevention, early diagnosis, and proper management. You can help educate patients about lifestyle changes tailored to Indian diets and culture, emphasize adherence to medications, and encourage regular screening. Understanding the Indian scenario helps you appreciate the scale of the problem and motivates you to contribute actively in diabetes care. Diabetes management has evolved tremendously over recent years, with new treatments and technologies improving patient outcomes. One exciting advance is the development of new classes of medications, like SGLT2 inhibitors and GLP-1 receptor agonists, which not only lower blood sugar but also offer benefits like weight loss and cardiovascular protection. Technology has also transformed care. Continuous glucose monitors, CGMs, allow real-time blood sugar tracking without frequent finger pricks. Insulin pumps provide precise insulin delivery, improving quality of life. Research into artificial pancreas systems that combine CGM and insulin pumps is progressing, aiming to automate insulin delivery and reduce hypoglycemia. Additionally, personalized medicine and genetic studies are opening doors to tailor treatments based on individual patient profiles. As pharmacists, staying updated with these advances enables you to guide patients better and collaborate effectively with healthcare teams. The future of diabetes care looks promising, and you will be key players in implementing these innovations. To wrap up our session today on Diabetes Mellitus, let's revisit the key points. Diabetes is a complex, chronic condition that requires a comprehensive understanding of its types, causes, symptoms, and complications. We saw how type 1 and type 2 diabetes differ in their pathophysiology and why proper diagnosis through specific criteria is crucial. Management isn't just about medicines. Lifestyle changes form the backbone of care, helping prevent complications and improve quality of life. Pharmacological treatments, including insulin and various oral drugs, play essential roles depending on the type and severity of diabetes. We also discussed how frequent monitoring of blood glucose helps tailor treatment and prevent emergencies. Looking at the Indian scenario highlighted the huge challenge diabetes poses in our country, emphasizing the importance of awareness, early diagnosis, and culturally appropriate management. Finally, exciting recent advances in drugs and technology promise better control and patient outcomes in the future. As pharmacists, you will be vital members of the healthcare team, educating, supporting, and empowering patients to manage their diabetes effectively. Remember, diabetes management is a lifelong commitment, but with the right knowledge and approach, we can help patients live healthier, longer lives. Thank you for your attention, and I encourage you to keep learning and stay updated on this evolving field.